Hi everyone, welcome back to another episode of the Breast Cancer Physio. In this episode, I'm going to be talking about why one physiotherapy appointment is essential after being diagnosed with breast cancer, because unfortunately it's not commonplace that patients who get diagnosed with breast cancer automatically get referred on to physiotherapy or physical therapy. So if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give the video a big thumbs up and leave a comment in the section below if you have any questions on why it is essential to get physiotherapy after a breast cancer diagnosis. So when we talk about one physiotherapy appointment being essential after you're diagnosed, what I'm really alluding to here is that you want to get onto physio in probably the first 2 to 4 weeks after you've been diagnosed or after you've been operated on. Now, sometimes people don't go straight onto surgery. They'll have their chemotherapy first. And that's okay, but in general, to get yourself educated and equipped from a physiotherapy perspective when it comes to breast cancer, seeing a physiotherapist or physical therapist within the first 2 to 4 weeks after diagnosis is a really good idea. Now, some people might say 2 to 4 weeks is ridiculous because there's so many appointments going on at that time in your breast cancer experience that it's not even possible to get to physiotherapy. But that's just one reason I wanted to do this video, is to show people how important physiotherapy is in terms of providing education on some of the other big issues around breast cancer treatment. So the first reason it's important to get one physiotherapy session after being diagnosed with breast cancer is to assess and treat any shoulder range of motion restriction. Now, most of the time, if patients are being referred to physiotherapy, it's following their surgery, but it can also come before surgery, such as if they're having neoadjuvant chemotherapy. Restricted shoulder range of motion is a really common issue when it comes to being treated for breast cancer, and there's a number of factors that contribute to this problem, such as cording, which is the thickened cord-like structure that can appear under the armpit or in the trunk, chest wall, or the length of the arm following axillary lymph node dissection or sentinel node biopsy. There's also pain from surgical wounds and just pain in general from having treatment. There's scars that are healing, which also become tight and restrictive. And there's also just the general nature that causes us to protect our chest wall or breast if we've just gone through surgery or any other major treatment for breast cancer. When you protect your shoulder, you tend to draw the shoulder forward, which tends to pull tight through your pectoralis muscles and also makes the muscles at the back of the shoulder quite tight. Interestingly, this can become a problem even if you're not aware of it. So what I mean by that is often I will say to patients, how's your shoulder range of motion going when I first assess them? And they will say, yep, no, fine, I've got full range of motion in my shoulder. But what they can't feel is that they're actually lacking that last 10 or 20 degrees of range of motion. And this is one of the reasons I wanted to do this video as well, is because physiotherapists or physical therapists who specialize in looking after patients with breast cancer, or any other specialty for that matter, we know what we're looking for where you may not. So what I'm talking about in the context of shoulder range of motion is the fact that if you lift your arm up and I can see that you're lacking that last 10 to 20 degrees of range of motion in your shoulder, what that indicates to me is that you're most likely tight through your pectoralis or through the muscles in the back of the shoulder blade. It may also indicate you're stiff in your neck or your upper back through your rib cage or thoracic spine. But to the patient who's going through breast cancer for the first time, this may be something you're completely unaware of. And that's totally understandable as well. If you've never been through this before, you don't know what you're actually meant to be looking out for. And when it comes to medical professionals, this is not necessarily a topic that they're going to cover anyway. So this is why physiotherapy is so important to be referred on to when you've had a diagnosis of breast cancer, because this is just some of the other things that could happen to you following side effects of treatment. As you can imagine with a shoulder, it's really important to regain your full range of motion so you can actually become a functional person again, because you still need to get back into things like carrying shopping bags, picking up grandkids or picking up your own children, cleaning your house, lifting a handbag, and so on and so forth. So regaining full range of motion to regain full function is a really important reason to get to physio, so that the physiotherapist can assess whether there's any stiffness, tension, loss of range, loss of muscle mass in the shoulder that they can help you sort out. The last reason it's actually really important to regain full range of motion in your shoulder is if part of your breast cancer treatment regime includes radiation. The positioning for radiation therapy usually is this, so you can see from what I'm demonstrating on the camera now is that you need quite a significant range of motion in your shoulder to be able to tolerate the positioning for radiation. So particularly if you've come out of surgery and you're not having chemotherapy, and particularly in the consideration that you may have something like cording going on which can restrict your shoulder range of motion, it's going to make it really difficult potentially for you to go straight from surgery into radiation if you don't have full range of motion of that shoulder. The next most important reason to get referred for one physiotherapy session after breast cancer is also to assess whether you've got ongoing issues with pain. Now, most people may have been given some post-operative instructions on how to get their upper limb moving again after breast cancer surgery. One of the most common things that I find is that people are often asking me, when do I actually stop those exercises? And the answer to that question is once you've regained full range of motion in those ranges that are described on the sheet of paper. However, if over some weeks you aren't able to regain full range of motion in your shoulder, as an example, this is usually an indication that there's other things going on that are going to stop you from getting there, like tight muscles, cording, seromas, or just wounds that have turned into scar tissue that are becoming really tight. Trapped fluid such as a seroma or just general swelling from your surgery may also be restricting your range of motion. And as we mentioned in the first point around shoulder range of motion, generally protecting or overprotecting, I should say, your body could be leading to increased pain. There's also a condition called postoperative myalgia, which is basically where your nervous system has a little bit of a pain party and it goes into overdrive. And that can be another reason to get to physiotherapy, because all of these issues we're able to help you with. Resolving your pain is so important because it allows you to get moving again, and the more you can move, the more normal you feel. The more normal you feel, the easier it is to get through breast cancer, because it is things like chronic pain that start to get people really down with their mental health. And if your mental health is down, you're not going to necessarily feel like doing things like exercise or eating in a really healthy way or as healthily as you possibly can during your breast cancer treatment. So make sure you are attending to any issues of pain, because that's going to have a big flow-on effect even into areas of your life like sleep, which, as you would know if you've been diagnosed or if you've been through treatment, this can have a big impact on your sleep without pain even being in the picture. Reason number 3 to get to a physiotherapist after you've been diagnosed with breast cancer is for lymphedema prevention. Now, lymphedema is a condition in which when lymph nodes are surgically removed or radiation is performed over areas where there's lymph nodes or lymph vessels, you're at risk of lymphedema, which is the buildup of excessive lymphatic fluid in a limb or in your trunk or other parts of the body. The most typical areas that women or men who have been diagnosed with breast cancer are at risk of lymphedema is in the upper limb or the breast or chest wall, because these are the areas that are typically having to undergo treatment on lymphatic vessels or nodes when you've got breast cancer. Regardless of whether you've had an axillary lymph node dissection, which means a larger number of lymph nodes removed, or just a sentinel node biopsy, which is usually between 1 or 4 lymph nodes removed, it's really important that you get educated on lymphedema, because there's a common misconception that if you've only had a sentinel node biopsy that you're not going to get lymphedema, and that if you've had a huge number of lymph nodes removed, you are going to get lymphedema. Regardless of the number of lymph nodes removed, there's no guarantee as to whether you do or don't get lymphedema. So if that's the case, then whether or not you've had 2 or 42 removed, it's a really great thing to get educated on it. There's a lot of people out there who are really scared about getting lymphedema, But rather than be scared, I try to encourage my patients to be educated and alert rather than cautious and frightened, because cautious and frightened are no good for the long term for your mental health. Being educated and alert as to what you should and shouldn't do around lymphedema is a much, much better place to be. There's a lot of myths and misconceptions around lymphedema out there in the community, and you can get a lot of misinformation if you don't talk to the right people. As an example, a lot of people are really worried that if they've had their dominant arm operated on, meaning if they've had lymph nodes removed from their dominant armpit, then they're at higher risk of lymphedema because they're going to use that arm more often. And the opposite is probably true, meaning that if you're using your arm on a regular basis, the muscle contraction and physical movement is going to enhance lymphatic flow. So the lymph system relies on muscle pump activity, gravity, movement to help flush the lymphatic fluid away. So if you're using your dominant arm, that's a good thing. And that's just one small example of where a lot of people are unaware or a little bit misguided on what's correct information around lymphedema risk. Another really important aspect of lymphedema prevention is LDEX measuring, or lymphedema index devices that can take a snapshot of your lymphatic system. So a lot of physical therapists, physiotherapists, occupational therapists, or lymphedema trained nurses have access to what we call an LDEX device, and these are fantastic for helping the prevention of lymphedema, because these devices can pick up lymphedema at the earliest point in time if you're aware of signs and symptoms and you're being monitored early. The fourth reason to get to a physiotherapist after being diagnosed with breast cancer is for exercise education. Exercise is one of the best things that you can engage with to get you through your breast cancer treatment. Not only does it improve your mental health significantly if you're doing regular exercise, but it also helps dampen the side effects of a lot of the treatment that is used during breast cancer, particularly chemotherapy. Issues such as nausea and fatigue that come off the back of chemotherapy can be significantly dampened just by doing some light, regular exercise. Exercise doesn't need to be a marathon that's done 3 times a day, but the other thing about exercise that's important is that you get guided on how to do it appropriately. And that's where a physiotherapist can be really, really effective as part of your treatment team, because a lot of people are often asking me questions about how to exercise. And I think in the context of breast cancer, there's actually a lot of information that is required for the patient as to how they can safely perform it and effectively perform it at that. Fatigue is a big issue when it comes to breast cancer treatment, and if you're tired a lot of the time, exercise almost seems like a contradictory thing to be doing. But in actual fact, every part of the research that's ever been done on breast cancer and exercise really shows a very positive effect, as long as it's done safely and generally under the guidance of a physical therapist, physiotherapist, or exercise physiologist. It's really, really great if the person that you're working with has experience with treating patients with breast cancer when it comes to exercise prescription as well. So like I said at the start of this video, in that first 2 to 4 weeks, if you can just get to 1 physiotherapy appointment so you can start to get educated on the role of physiotherapy in breast cancer, you're going to do yourself a huge world of favors. Thank you so much for watching this video, guys. I hope you've gained some great information on why it is so important to go and get at least 1 appointment with a physiotherapist following a breast cancer diagnosis. If you have any questions about this video, then please leave a comment in the section below, and I'll see you next time for another video.